Hi guys, welcome to Nurse's Handbook, and today I am here with a set of multiple choice questions which may be helpful in your nursing competitive exams. Question number 1. A patient with diabetes mellitus may experience hypoglycemia as well as hyperglycemia. Which one of the following clinical manifestations is commonly seen in hypoglycemia? Option 1, weight loss. Option 2, nausea and vomiting. Option 3, polyuria. And option 4, diaphoresis. And the correct answer is option 4, diaphoresis. So what is diaphoresis? It is a medical term used to describe excessive or abnormal sweating. And now we know that diaphoresis is one of the most common symptoms of hypoglycemia. What is hypoglycemia? It is a condition where the blood sugar level is lower than the standard range or the normal range. If the fasting blood sugar is less than 70 mg per dl or 3.9 millimoles per liter, then it is a red alert for the healthcare workers. It means that they have to take an immediate action for their patient. Now the question comes, why abnormal sweating or diaphoresis occurs in hypoglycemia? It is because whenever the blood sugar level declines, adrenaline is produced in the body, and this adrenaline narrows the blood vessels and activates the sweat glands. Now let us see some of the signs and symptoms of hypoglycemia. It includes shakiness, looking pale, headache, hunger, nausea, irritability, anxiety, difficulty in concentrating, lightheadedness, and in some patients they may be complaining of tingling or numbness of the lips, tongue or cheek. There are some other signs and symptoms like the worsened signs and symptoms in which we need to take the immediate action. Now let us see what are those signs and symptoms. It is confusion, unusual behavior, inability to complete the routine task, loss of coordination, slurred speech, blurry vision, unresponsiveness, and some patients may experience seizures also. Question number 2. The nurse is preparing to administer 0.05 mg of digoxin intravenously. The available concentration is 0.5 mg in 2 ml. How many milliliters should the nurse administer? Options are 0.2 ml, option 2 0.3 ml, option 3 0.4 ml, and option 4 0.5 ml. And the correct answer is option 1, 0.2 ml. So now let us see how we got the answer 0.2 ml. So here the formula which we are going to use is the desired dose upon dose in hand into quantity available is equal to quantity desired. So from the question we know that the desired dose was 0.05 mg. The dose which was available in our hand was 0.5 mg. And the quantity available in our hand was 2 ml. And in the question it was asked to calculate the ml that the nurse will be administering. So we will be putting all these values in the above mentioned formula and we will be getting the answer as 0.2 ml. Question number 3. Is the electrocardiographic finding consistent with an acute injury process is the presence of A or an option 1 Q wave, option 2 inverted T wave, option 3 elevated ST segment, and option 4 depressed ST segment. And the correct answer is option 3 elevated ST segment. So before I talk to you about the elevated ST segment, we should know what is a ST segment here. So as you can see in this ECG, that ST segment is the flat isoelectric section of the ECG which starts at the end of the S wave, which is known as the J point, and extends up to the beginning of the T wave here. So now the question comes, what does the ST segment represents? The ST segment represents the interval between the ventricular depolarization and the repolarization. Now in this ECG you can see here the first ECG, you can see the ST segment is an isoelectric line present without any changes here. But in the second side, on the right hand side, you can see the ST segment has raised from its normal position. So whenever there is a ST segment abnormality, means if there is an elevation or depression, it means that it is myocardial ischemia, or in cases of infarction, the ST segment changes occurs. Question number 4. While giving cardiopulmonary resuscitation to an adult, the recommended ratio of external chest compression to ventilation in 2 rescuers CPR as per 2020 American Heart Association guidelines are: option 1 30:1, option 2 15:1, option 3 30:2, and option 4 15:2. And the correct answer is 30:2. As per American Heart Association 2020 guidelines, whenever we are giving a CPR to the adult person, if there is a single person or if there is a double person to rescue, the chest to ventilation ratio will be always same, and that is 30:2. Question number 5. At what rate should the nurse start an intravenous infusion if the order is for 1 gram of vancomycin to be given in 100 ml of 5% dextrose over an hour? The tubing delivers 60 microdrips per ml. The options are 30 per minute, option 2 50 per minute, option 3 60 per minute, and option 4 100 per minute. And the correct answer is option 4 100 per minute. Now let us see how we got the answer 100 per minute. The formula here we have used is flow rate is equal to total volume, that is to be in ml, upon total time in minutes into the drop factor. So in the question it was given the total volume to be infused was 100 ml. Time was given 1 hour. By multiplying it with 60 we have converted into minutes. And the drop factor given was 60 drops per ml. So putting all these values in the above mentioned formula, we get the answer 100 microdrip per minute. Question number 6. Which organ secretes enzymes capable of digesting food in the absence of all other digestive enzymes? Option 1 salivary gland, option 2 stomach, option 3 pancreas, and option 4 liver. And the correct answer is option 3 pancreas. As we know, pancreas is an organ located in the abdomen, and it has got two main functions. First is the exocrine function, which helps in digestion, and second is the endocrine function that regulates the blood sugar. Now let us see the enzymes secreted by the pancreas. First we have trypsin and chymotrypsin, which helps in the digestion of proteins. Amylase helps in digesting the carbohydrates. Lipase breaks down fats, and pancreatic juice and bile, which is released into the duodenum, helps in digesting fats, carbohydrates, and proteins. Question number 7. What will happen to the sugar content of CSF during bacterial meningitis? And the options are: 1 no sugar, 2nd increase, 3rd option decrease, and 4th normal. And the correct answer is option 3 decrease. Children with bacterial meningitis have low levels of CSF glucose because of the process of glycolysis by white cells and the pathogen. Second reason for the low levels of CSF glucose is because of the impaired CSF glucose transport. The level of CSF glucose is interpreted in relation to that of the serum glucose. Why? Because glucose can easily pass across the blood-brain barrier. Question number 8. Reflux of gastric contents back into the esophagus is prevented by the: option 1 effect of gravity, option 2 lower esophageal sphincter, option 3 epiglottis, and option 4 pyloric sphincter. And the correct answer is option 2 lower esophageal sphincter. At the lower esophagus we have a ring of muscle fibers which prevents the swallowed food from moving back up. And this muscle fiber is known as the lower esophageal sphincter. When this ring of muscle does not close, stomach contents can leak back into the esophagus. And this process or this condition of leaking back into the esophagus is known as the reflux or the gastroesophageal reflux. Question number 9. Which one of the following assessment would the nurse perform when assessing an ataxic patient's ability to walk? Option are first Kernick's test, option 2 Romberg's test, option 3 mini mental status examination, and option 4 Hoffman's test. And the correct answer is option 2 Romberg's test. So before telling you about the Romberg's test, let us see what is ataxia. It is a term for a group of disorder which specially affects the three things, that is coordination, balance and speech. Any part of the body can be affected, but people with ataxia most oftenly find difficulties with balance and walking, speaking, swallowing, tasks which require high degree of control like writing and eating, and some people may also find difficulty with vision. Now coming to the Romberg's test, it is an appropriate tool which is used to diagnose sensory ataxia. In sensory ataxia, the gait will be disturbed because of the abnormal proprioception. What is proprioception? It is the body's ability to sense its movement. So if a patient is ataxic and Romberg's test is positive, it means that ataxia is sensory in nature. But if a patient is ataxic and Romberg's test is not positive, it suggests that ataxia is cerebellar in nature. Question number 10. Which one of the following is the best measure to determine long-term control of blood sugar in a patient with diabetes mellitus? And the options are first glucose tolerance test, option 2 fasting blood sugar, option 3 postprandial blood sugar, and option 4 glycosylated hemoglobin. And the correct answer is option 4 glycosylated hemoglobin. Glycosylated hemoglobin, or we call it as the HbA1c test, measures the amount of blood sugar or glucose that is attached to the hemoglobin. This HbA1c test is used to diagnose diabetes, as well as it is also used to monitor the efficacy of treatment. An HbA1c test shows what the average amount of glucose attached to hemoglobin over the past 3 months. So why it gives an average of past 3 months? Because that is how long a red blood cell lives. Thank you for watching. For more videos and updates like this, do like, share and subscribe to our channel Nurse's Handbook. For any queries and doubts, please post it in the comments.